Hi everybody, Dr. Ahles here. In this short video, we're going to talk about how the heart sounds that your doctor listens for when they're listening to see how your heart is doing, how we make those using the valves that we just talked about dividing up those heart chambers. So when we talk about your heart sounds, we very technically call them lub and dub. These are the sounds that we can detect when we listen to the valves in your heart close. So the lub and the dub are when different valves slam shut. They're an indication for me of different chambers of the heart contracting. So when we close the cuspid valves, that's the tricuspid and the bicuspid, those valves between the atria and the ventricles, that's where that sound lub comes from. So lub is kind of the beginning of a heartbeat, and it's caused by those cuspid valves closing. Those close when my ventricles contract. When my ventricles are done contracting, we see the semilunar valves slam shut. That's the aortic semilunar and the pulmonary semilunar valves. These generate that dub sound. So different sets of valves closing, whether it's the cuspid valves, so separating the atria from the ventricles, that's lub, and the semilunar valves closing, generating that dub sound. When your doctor is listening to your heart, they will actually listen at 4 different locations on your chest. None of those locations are actually right on top of the valves that we see in your heart. They're all actually in places where blood will be going after it passes through that valve. So for example, when I'm trying to listen for the tricuspid valve, I'm going to listen slightly below that ventricle, the left ventricle. Same thing with the mitral valve or the bicuspid valve. I'm going to listen down below the left ventricle. When I'm listening for those semilunar valves, the aortic and the pulmonary, I'm going to listen in locations that kind of correspond with either the pulmonary arteries sending blood away from the heart, or I'm going to look at locations where we start to see branching of our aorta over here to catch that aortic valve. So big picture idea with these heart sounds, they give me an idea of when different valves open or close. They give me an idea of my heart rate, the number of times my ventricles are contracting and relaxing. We use a stethoscope, and part of why your doctor is listening to your heartbeat is to make sure that your valves are functioning properly. We get these things called heart murmurs when the valves are not functioning properly. So when your doctor is listening to your heartbeat, they should hear one short sound and one really short sound. We've got that lub from the tricuspid and bicuspid valve closing, and we've got the dub from the aortic semilunar and the pulmonary semilunar. But notice that sometimes your doctor might hear an extended sound where we would have heard a short and another short, they just hear kind of a whir. Or maybe we hear kind of a low movement of blood whirring through different valves. So let's talk about what would cause these different kinds of sounds that we see that are heart murmurs. Which, by the way, I promise I'm not going to show you these pictures and ask you what we're looking at. What I am going to ask you is about these 2 kinds of problems. So the first problem we can have with our valves is called stenosis. When we talk about stenosis, what that means literally is a narrowing. So in stenosis, the flaps of our valves have hardened. They're no longer able to open as far as they should. So when we do the process of contraction, not as much blood is getting through that valve with each contraction, making it harder for our heart to be efficient. So when we look at stenosis, normally our valves will squeeze together and then they'll open completely when we're pushing blood through them. In someone with a stenotic valve, a hardened valve, notice that the opening for blood to pass through is a lot smaller. And it's possible as well that we might not even actually efficiently close that valve all the way. So if we look over here at our heart sounds, Notice that stenosis we see with extended sounds. So stenosis means that our valves are not efficient at pushing that blood through. The blood kind of gets stuck in between those phases of the cardiac cycle. So these extended sounds that we hear close to when we're trying to open or close chambers, that would be an example of stenosis. The other problem we can have with heart valves as well, though, is what we would call valve incompetency. When I say that a valve is incompetent, what I mean is it doesn't close all the way. So stenosis is a problem with the valve not opening all the way because the flaps are too hard. Incompetency is what happens when the valves won't close all the way. So when the valves don't close all the way, we start to see blood leaking back the wrong direction. Our technical name for that blood going the wrong direction is regurgitation. So we look at a picture down here. First, blood tries to go into the pulmonary artery. In normal circumstances, when we're squeezing the ventricle, it goes straight up into that pulmonary artery. But in someone with an incompetent tricuspid valve, when they pump the blood, some of it is going to go up that pulmonary trunk, but because this valve isn't sealed all the way, some of it goes back into the atrium. So regurgitation is an example of the blood not going one direction. Remember, that was the function of our valves. So when we look at regurgitation will hear a low-level whirring throughout the entire contraction. So remember that our second sound was from the semilunar valves. So we should hear them slam shut and have no noise because no blood is leaking back through. So if your doctor hears kind of a low-level whirring after that, where that second sound would be, that gives me an idea that the semilunar valves, most typically the aortic semilunar valve, is leaking. Whereas if your doctor, instead of that first slamming shut sound, hears a low whirring sound before the second sound, that tells them that the bicuspid valve, the mitral valve, is not closing correctly. There's a small whirring of blood constantly slipping through. So big picture, what do we want to know about heart sounds? Number one, we want to know that those sounds come from our valves closing. Different sounds come from different valves. Your first heart sound, the lub, comes from the cuspid valves. The second heart sound, the dub, comes from the semilunar valves. If those valves either don't open all the way or they don't close all the way, we will hear abnormalities in the heart sounds, and those abnormalities are called heart murmurs.